Hello, I'm Dr. Valentine Wlianu. I'm a periodontist practicing in Toronto, Ontario. And in this video, I'll be discussing bone grafting procedures. Once a tooth is lost, the supporting jawbone atrophies, and generally 25% of its structure is lost within the first year. The replacement of supporting bone becomes more complex as time passes, and it is for this reason that dental implants are more easily placed closer to the time when teeth are first extracted. Dental implants are extremely successful because they act very similarly to natural teeth. They safeguard and preserve the original jawbone structure. Although age is not a factor, conditions such as uncontrolled diabetes and a history of radiation therapy to the jawbone has been shown to lower the success rate of bone grafting and implant treatment. Habits such as smoking will also negatively affect treatment success. X-rays of the jaw will help the implant surgeon determine if the supporting jawbone is of sufficient dimension to accommodate an implant, and if bone grafting is indicated. The most common types of bone replacement grafts used today are allograft and xenograft. An allograft is human tissue transplanted from one individual to another. Xenograft is tissue transplanted from a donor of a different species. Bovine bone is the most commonly used xenograft. In both cases, the donor tissue will undergo rigorous testing and processing. All measures are taken to assure patient safety. Both allograft and xenograft may be placed into the recipient site to help regenerate missing bone. They serve as a framework or scaffold allowing bone from the surrounding recipient area to grow in and fill the void. The first procedure I'll be discussing is socket preservation. Removal of a tooth is sometimes necessary because of infection, severe bone loss, or fracture of the tooth. The bone that holds the tooth in place, also known as the socket, may be reduced in volume by periodontal disease or a long-standing infection. The void that remains following tooth removal may create a problem, especially if the plan is to replace the tooth with a dental implant. The jaw deformity can be regenerated by a procedure called socket preservation. This will significantly increase your chances of having a successful and long-lasting dental implant. After the tooth is removed, the remaining socket is filled with bone graft material. It is then covered with an artificial membrane. The socket will then heal with minimal shrinkage and collapse of the surrounding gum tissue. The regenerated bone in the socket will provide a foundation for the future implant. Your dentist may recommend that a tooth be removed. If you are considering replacing the tooth with an implant later on, be sure to ask if socket preservation is necessary. The second procedure is a lateral ridge augmentation. This is another common type of bone grafting procedure. It is used for areas of extensive bone loss. It is usually performed a few weeks following a tooth extraction. The end goal is the same as a socket preservation, which is to help regenerate supporting bone for a future dental implant. Supporting framework may temporarily be installed over top the bone graft material to help prevent collapse of the area during healing. After the graft has healed, the site is re-entered, the framework is removed, and the implant is placed. The third procedure is a sinus augmentation. Sinus bone grafts are performed to help regenerate missing bone in the upper posterior jaw. The maxillary sinuses are air-filled cavities which lie beneath your cheeks and on top of the upper posterior teeth. Some of the roots of natural upper teeth may extend upwards into the maxillary sinuses. When these upper teeth are removed, the remaining jawbone has a tendency to shrink in size, and the maxillary sinuses tend to grow into the space of the missing tooth roots. The remaining jawbone is very thin. When the sinus wall is very thin, it is impossible to place implants in this bone. Fortunately, a sinus augmentation may be done to help regenerate this missing bone. In the most common sinus augmentation procedure, a small opening is prepared into the bone overlying the maxillary sinus, and the membrane lining the sinus is pushed upward. The underlying space is filled with bone graft material. The area is then left to heal for several months to allow the bone graft to incorporate. Dental implants are then inserted in the newly regenerated bone. In certain cases, there may already be enough bone to allow the placement of an implant and sinus augmentation at the same time. Your implant surgeon will determine which type of bone graft and implant procedure is right for you. A bone graft procedure takes approximately 1 to 2 hours. It may be done with local anesthetic alone or in combination with sedation. Most patients are back at work 1 to 2 days after having had either a socket preservation, lateral ridge augmentation, or a sinus augmentation. The majority of healing takes place during the first month, and patients may then resume most of their normal eating and oral hygiene practices. Your implant surgeon will see you for a 1-week and 4-week post-operative check. Thank you.